Well, a recent study put the United States at #1 for the most expensive country for mental health care. So what can be done to improve financial access for patients? Fox 43's Madeline Cudahy looked into the issue to find out.
Spending on mental health care treatments and services reached $225 billion in 2019, and 71 of that was just on treatment for depressive disorders.
Mental health is medical health. There's really no difference.
Alyssa Ott with Keystone Therapy and Trauma says access to care can be expensive, especially when the numbers of people in need are rising.
So you're looking at a system of they're approving more individuals for medical assistance in particular, but then there's not the providers that are needed.
Across the Commonwealth, yearly, the average out-of-pocket cost for adult with mental illness can tally more than $8,400. And the Kaiser Family Foundation survey found that 27% of people who say they need care for mental health aren't receiving it because of the high cost.
Sometimes what you're looking at when you're talking about the people that can't afford it is essentially an issue of payers not paying providers enough.
Ott says without a better structure for people to find and access the care they need, those costs will only increase.
So then what that would look like is essentially a provider that doesn't work with your specialty. So the problem will get worse. Then what's going to happen? Then they're going to need a higher level of care because they're not getting the specialized care at the base level to really work through that specific problem.
And then the costs add up.
Costs add up over time completely.
A system in need of reshaping to provide more cost-effective care for Pennsylvanians. Madeline Cudahy, Fox 43 News.